Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
When it comes to bone health, this is not something that just women should be focusing in on. On today's episode, I'm going to talk about osteoporosis, osteopenia, what that actually means, and what you can be doing as you get older to make sure that you maintain good bone mineral density. So I am Amanda Williams, MD, MPH, and I am going to be discussing all different aspects when it comes to bone health. We know that there's many factors that can impact bone loss through the years, and I'm going to talk about some of those risk factors and certain medications that we know are linked to low bone density. But first, let's just talk about some statistics. We know that osteoporosis is considered to be a silent disease because people don't recognize that your bones are getting weaker. You may recognize if your muscles feel weaker, but you're not going to recognize that your bones are getting weaker. Most people don't even know that they have osteoporosis until after they break a bone. So if you're not going in and having regular bone mineral density tests, which is usually just done in postmenopausal females, then you may have no idea at the rate of bone loss that you're actually experiencing, which is why over 10 million Americans have osteoporosis and another close to 50 million Americans have the low bone mineral density, also known as osteopenia. So they still fall into that category. So osteoporosis is more severe. Osteopenia, that is having low bone density. And that's a lot of people. That's an awful lot of people. We know that there are so many different factors. We know that women oftentimes are more prone to bone loss. And the reason why is because postmenopausal women, you have less estrogen. Estrogen is very beneficial for maintaining your bone strength and the bone density. So as estrogen levels start to plummet, this is when you start to see weakening of the actual bones. So this is that connection, that hormonal connection. Sometimes we think about bone health and we're only thinking about it in the regards of calcium and vitamin D, but it goes well beyond that. So that's why I want to kind of break all of this down for you so you understand. Now we can look at diet. We can see that foods matter to your bones, and that if you are following a standard American diet with highly processed foods, the likelihood of you getting comprehensive trace minerals and essential vitamins and minerals to maintain bone remineralization, probably not that good. So this is why we always want to make sure that it doesn't matter what our age is, that we make those adjustments to our diet, that we are incorporating in foods that are going to provide a really wonderful source of these vitamins and minerals to help to support our bones as we get older. And this is really important because we know for women, the likelihood of having a broken bone is even greater than that of having a heart attack or a stroke or even breast cancer, even when you combine all of those. So this is a major issue. But remember, men are not isolated or somehow protected to such a degree that they don't have to worry about it. Because 1 in 4 men over the age of 50 will break a bone due to osteoporosis. So that's 25% of men over the age of 50. And you never hear about this. You never hear about how common this is. And part of the reason why that is because when someone breaks a bone and goes in and has their bone treated, generally speaking, Americans who suffer fractures are not tested or treated for osteoporosis. 80% of older Americans who suffer bone breaks are not tested or treated. So say if a gentleman in his 60s or 70s breaks a bone, goes into the doctors, they're going to treat the fracture, but they're never going to look at the fact that this is happening because of osteoporosis. Because, well, that's not a man's issue. This is only a woman's issue. We know that not to be the case. 25% of men over the age of 50 will fall into that category of osteoporosis and be more at risk for a bone fracture. So this is why it's so advantageous to make sure that you know the facts. Make sure that you understand what can be leading to additional bone loss. Are you not exercising? Are you not maintaining your core strength? Maintaining the muscles that support the skeleton. All of these things are really, really critical as we get older. So now let's look at some of the other reasons as to why people can develop more progressive bone loss or loss of bone mineral density. So we can look, obviously, at gender. We know females are going to be more prone, but it does not say that men cannot get bone loss. We know this. We know that as we get older, increased age is definitely associated with this. We can look at family history. There's certainly a genetic component to this. We can look at obesity. They used to always think that having higher body fat was somehow protective against osteoporosis. Now they know that that is technically not the case, because having obesity is more linked to having insulin resistance and hypertension and increased triglycerides and all of these factors that can lead to low bone mineral density. We know that cardiovascular disease is certainly directly correlated with osteoporosis and osteopenia. We know this because in cardiovascular disease, we have extensive oxidative stress and oxidative cellular damage and inflammation. These are all things that can affect the bones. But let's look at certain medications, because this is oftentimes very interesting to people. They might be on one of these medications and go, oh my gosh, I had no idea. SSRIs, for example, the selective serotonin reuptake inhibitors. These are utilized for depression. So the antidepressants have been linked to an increased risk of osteoporosis. We can look at blood thinning medications, the anticoagulants. Coumadin, for example. We know that this has been linked with decreased bone mineralization. So these are things that we need to be aware of. They have been able to link correlations between proton pump inhibitors for acid reflux. So people who are taking this on a regular basis year after year after year because they have heartburn, that they're not addressing the underlying issue, and they're taking these medications, this can lead to losing bone mass, which is not a good thing. So these are all issues that we know. One thing that I usually encourage people to do is make sure that you know where all of your hormone levels are. Know where those vital hormone levels are. Not just for females, but also for males. Looking at things like your estradiol level. Looking at sex hormone binding globulin. Sex hormone binding globulin is produced primarily in the liver, but it serves as a means for binding estrogen and testosterone. And we know that the declining estrogen levels is what has been linked to loss of bone density in both men and women. So if we have a rise in sex hormone binding globulin, then we can directly correlate that to bone loss. So just having a simple blood test, looking at this specific hormone, if we see that that level is going up, we can directly say then, we know we are experiencing bone loss. Because remember, that's a silent disease. We can't tell unless we're going in and doing a bone density scan, but we can certainly look at certain hormone levels that can give us a clue, a window into how healthy our bones actually are. If we know we have insulin resistance and we know that we have excessive glycation that's occurring, we can rationalize through that and say, okay, I know that this is probably doing damage to my bones. We have to be aware of that. If we have hypertension, if we have cardiovascular disease, we know that that oxidative stress and that chronic inflammation can be damaging the bones themselves. Then we look at just the basic things. If someone is low in trace minerals, things like boron, magnesium, and we know that over 50% of Americans are low in magnesium, and we need magnesium to maintain bone density, then we can also put ourselves into that category and say, okay, look at all these risk factors I have. I'm getting older. Maybe I'm a postmenopausal woman. I know my magnesium status is low. Been told in the past my vitamin D level is low. I don't really exercise. And maybe in the past I was on a selective serotonin reuptake inhibitor for 5-10 years. I mean, you have to think about these things, because if you don't, and say you're not going in and having regular bone density scans, I just said 80% of people who break bones do not get tested for osteoporosis at the time of that fracture. They just treat the fracture, but they don't actually assess for the underlying disease. So these are the reasons why we have to focus on lifestyle modifications to maintain our bones as we get older. We want to think about the things that we're doing in terms of dietary intake, adhering to that Mediterranean diet where we're going to incorporate high antioxidant foods to fend off oxidative stress. We want to make sure that we incorporate in the appropriate amounts of key vitamins and minerals that are critical to the maintaining of our bones. So make sure you're always having your serum vitamin D level tested. So you know if your level is low, if you're deficient or insufficient, you know that you're going to be supplementing with adequate vitamin D on a daily basis. Making sure that we're taking magnesium based on our bowel tolerance. Oftentimes people will ask me, well, how much magnesium should I be taking per day? You know, women should be getting somewhere around 350, 400 milligrams per day at the baseline. Men just slightly over that, about 400, 450. But that's the baseline. That doesn't mean that you may not require a higher amount than that. So I would say the best way to tell with magnesium is based on your bowel tolerance. If you get too much, you're going to know, because it can create a situation where you have loose stool from that. But I've had people who take upwards of 1,000 or even greater than 1,000 milligrams of magnesium daily. So it really is going to vary from one person to the next. And then we look at calcium. Now, this is that one area where oftentimes traditional doctors like to jump in and tell women, oh, you need 1,200 milligrams of calcium, and, you know, go to the pharmacy and buy yourself some over-the-counter calcium, which, by the way, is usually not a wonderful source in terms of the type of calcium that they're using. It's kind of like using sidewalk chalk. And they're telling them usually to take too much, because depending on a woman's diet, you may be obtaining a good amount of dietary calcium. And so I usually will advise somewhere between 500 milligrams and 1,000 milligrams of supplementation calcium. And ideally you would be taking that in the evening. Our bones are better at absorbing those minerals at night when we're sleeping. So taking your calcium supplementation later, so maybe with dinner or just before bed, that is generally speaking my advice. The other thing here's just another fun tip, is lysine. Now, who would ever think lysine, the simple amino acid lysine, which we usually think of it in the setting of the immune system. But lysine is required for proper dietary calcium absorption in the intestines. So for calcium to make its way into the bloodstream and then hence into the bones, we have to have adequate lysine. So they've been able to do clinical research studies showing just that. So back in the late 80s, early 90s is when they really started to focus in on that, recognizing that to have a positive calcium balance in the body, this was really in synergy with lysine status in the body. So this is why we would like to always focus in on lysine when it comes to proper bone health. So I usually will tell, especially postmenopausal women, even if you incorporate 500 milligrams a day of lysine into your routine, this can be very helpful, because say you're eating a lot of green leafy vegetables that are really packed with a wonderful amount of calcium. We want to make sure the body's going to properly absorb that. So by adding in lysine, this can help to facilitate that process. So lysine, kind of just one of those thinking outside of the box. I did an article a couple of years ago, which you can find on our website, but that was the title of it, was Thinking Outside of the Box when it comes to bone health. But talking about things like vitamin E, tocotrienols. Why? Because of oxidative stress. We know oxidative stress damages the bones. We can look at things like omega-3 fatty acids, the importance of things like krill oil and fish oil that can be very helpful to maintain bone mineral density for a variety of different reasons. We can look at targeting inflammation, that the omega-3s are easing inflammation as well as fending off oxidative stress. So it's not just about calcium and vitamin D. We have to think about vitamin K. You know, and K2 in particular, very beneficial. We think about boron, that key trace mineral that helps. We think about silica. Silica is very important for the tensile strength of the bone itself, because over time, if our bones become very rigid, then they are more likely to break. I always say, if you think of like a number 2 pencil and that just snaps, well, we want to be able to have some flexibility, and having silica on board really can lend to having that tensile strength. When you think about a suspension bridge or a parking garage, that concrete has that rebar in there to allow for that flexibility. Otherwise, that concrete would just crack. So you have to think about your bones that same way. There's still flexibility within the bones. If those we're not getting the right nutrients, and if we don't have exposure to things like silica, magnesium, calcium, vitamin D, then you start to lose that. And the bones themselves are becoming weaker, but yet more prone to that fracture. So there's a lot that goes to bone health. There's many different things that you can do to target and maintain bone health as you get older. You definitely want to make sure that you do comprehensive hormone testing. Look at that sex hormone binding globulin for both men and women. That can give you an insight as to if you're experiencing bone loss. Make sure that you are doing a basic exercise routine just to maintain the strength and flexibility of your core muscles. Make sure that you are looking at where you can make those adjustments in your diet. And think about things such as bone powder. You can go to our website, invitehealth.com, and check out bone powder. Think about vitamin K1, K2, thinking about lysine, and of course, vitamin D3. If you need additional magnesium to your routine, think about these things. These are just basic concepts when it comes to maintaining bone health, so we don't fall into that category of the over 10 million Americans who have osteoporosis and the close to 50 million Americans that we know have osteopenia. And remember, that's just what we know in terms of diagnosis. There are so many people who have low bone density that are never actually screened for it. So make sure that you take care of your bones. You're only given one skeleton, and you want to make sure that it's with you throughout your whole life. So thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts, or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe and you leave us a review, and you can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.